Hello to all my nursing colleagues. I wanted to take some time to express how I'm feeling, how appreciative and thankful I am for all the Milford Regional nurses. I think it's really important to the work that you're doing, the courage, the strength, and the dedication you have for your patients. And no year is more profound than this year and what we've been through. I'm very proud of how every day, each and every day, you carry out the mission of the hospital of compassion, dignity, and respect to your patients. And I would like to share some of my thoughts with you today. I want to take time to thank your families, all of your families, for their sacrifices. It's not easy on both sides, for you and for your family, not seeing members of your family and your extended family while working on the front lines. We have a program, A Day in Your Shoes, that Angela LaShore, one of our nurse educators, started. It was very successful, and we talked about expanding the program. Little did we know we would be living this experience. We have had nurses redeployed as PPE assist and RN assist. And when I rounded, I heard things like, it was an eye-opening experience. It felt so good knowing that I was helping my colleagues. So for them to be able to help and for the nurses on the COVID units to receive them and welcome them was really wonderful to see. It was appreciated on both sides. Each year during Nurses Week, we share clinical narratives. It's part of our celebration of nursing. These are powerful stories of what nurses do each day. And this year we postponed our clinical narrative event to the end of June, June 24th, because of the anticipated go-live of Expanse. And of course, we know that did not happen. I would like to still keep that date of June 24th for nurses to share their clinical narratives in a different forum. It would be via WebEx. I feel like we don't want to miss this opportunity to hear these powerful narratives. It's so important for us to appreciate and recognize and celebrate some of what nurses are doing every day. One example of a clinical narrative that I want to share with you today is one of our nurses, Kim Madigan, who's a float nurse, had an experience it was her first time caring for a dying patient, and it was on one of the COVID units. And she went above and beyond to care for this patient in so many ways. She sat with the patient, held the patient's hand. She helped the patient family connect before the patient died, the patient's son and daughter-in-law. Again, so important during this time when we can't have visitors in. And as you all know, the challenges of that and have experienced it. And in this case, Kim was able to connect the son and the daughter-in-law and again, make them feel comforted and able to connect. And then, very extraordinary, the priest was unable to come in to administer last rites. So Kim, again, in being innovative, wanted to make this happen. So she was able to have the priest by phone say the last rites to the patient, and she was able to obtain oil, which the priest was able to bless, and it helped to administer last rites to a patient. Again, extraordinary. And did it in such a way when I said to her how wonderful that was and how compassionate it was. I mean, her first response was, I couldn't have done it without my colleagues. My colleagues were helping me. They were going to get medication. They were, helping me all along the way. So again, just that unbelievable care at the bedside and doing anything to help a patient and comfort a patient in this moment was so appreciated. And that's just one example of a clinical narrative. And so I know there's so many other stories out there, but I want to thank Kim and I want to acknowledge all the nurses who are providing this extraordinary care every day. This year's Nurses Week theme is Nurses Excel, They Lead, They Innovate. And I think at Milford Regional Medical Center, we have done all of these things and more. Nurses excel in their commitment to provide excellent patient care every day. They lead by demonstrating resilience and determination while navigating this public health emergency. They've been innovative in finding ways to protect themselves during this COVID crisis and ways to connect patients and their families. Your excellence in practice and your collegiality have always been present, but they were magnified in this unprecedented healthcare crisis. 2020 is the year of the nurse. It's the 200th anniversary of the birth of Florence Nightingale, and how fitting that this year is the year of the nurse, with all we've been going through the public health crisis. I want to give a special recognition to Christina Nadal. She painted a picture of Florence Nightingale with her lamp, and it's a beautiful painting. She gave it to a number of frontline staff and also to some of the nursing leaders. And on the top of the painting, it has the words, "In the darkest hour, the lamp shines brightest." And how fitting that is for this particular time that we're going through. And I appreciate her words and her beautiful painting. It has great meaning. And truly at Milford Regional Medical Center, our nurses, they do shine the brightest. And Milford Regional nurses are truly the best.